Good morning, everyone. Thank you for coming to the Healthy Conversations presentation on nutrition for a healthy heart. We do have BD Medical, OC Tanner, and Salt Lake County on this presentation today, so that is fantastic. I do know that Sherry wanted to talk to a couple of her employees and just let them know how they can get points. So I'm going to unmute Sherry and let her talk to her employees for a second. Go ahead, Sherry.
Thank you. Yes, thank you very much. So just a reminder for those at BD Medical to earn your Sandy Total Wellness points, either email me or submit on WellWrite what you learned from the presentation today, or just some takeaways that you have, and then I will get those approved for you.
Great. Thank you, Sherry. Sadie, is your mic working yet?
Yeah, can you hear me?
Yeah, I can. Go ahead and talk to your employees.
All right, Salt Lake County employees, thanks for being here. I'm going to put the sign in for the chat box if you're Healthy Lifestyles participants so you can get points towards your rebate.
Great. Thank you, Sadie. And our speaker, Juliana, is here, so I'm unmuting her. I'm going to let her introduce herself and start her presentation.
Okay, great. Thanks, Kim. Can you hear me okay?
Yes, I hear you perfect. Thank you.
Okay, great. So hi, everyone. Thank you so much for joining me today for this presentation on nutrition for a healthy heart. Like Kim said, my name is Juliana Betker. I am a registered dietitian and I work at St. Mark's Hospital in our weight treatment center. I'm the coordinator for the clinic as well. So we'll start with the first slide here and just talk a little bit about heart disease. So many of you probably know the leading cause of death in the United States is heart disease. This it's kind of an umbrella term for many different types of heart conditions. Coronary artery disease is the most common, but it also includes different heart arrhythmias, as well as heart attack and heart failure. There are several risk factors for heart disease. Some of those include high blood pressure and high cholesterol, smoking, diabetes, being overweight, poor diet, being physically inactive, as well as excessive alcohol use. So diet is an important component of cardiovascular disease. It is considered to be a primordial prevention of heart disease. So that means existing from the beginning. So something that you can do to start preventing the development of any cardiovascular disease. It is something that the American Heart Association now defines as being the cornerstone of achieving ideal heart health. So many of cardiovascular disease cases can be prevented or delayed with healthy dietary choices, which we're going to talk about today, and lifestyle modifications as well that affect these different risk factors. So a heart healthy diet is, a very well balanced diet. What most of you probably think of, when you think of eating healthy food. So you want lots of fresh fruits and vegetables, whole grains, lots of nuts and seeds and healthy fats, fish and poultry, and vegetable oils. So we really want to limit alcohol, so in moderation, if at all. We also want to limit red and processed meats. So processed meats being like your sausages and bolognas, your cured meats, as well as refined carbohydrates. Refined carbohydrates are oftentimes like your very low fiber carbohydrates, right? So like white bread, white pasta, soda, candy, cookies, cakes, brownies, things like that, as well as food and beverages with added sugar and sodium, and foods with trans fats. So let's talk about what cholesterol is. So most people know what this term is, but may not totally understand like what it is and what it does in your body. So it is a waxy fat-like substance that is actually necessary for good health. It does help to build your cells and make vitamins. It's an important component of hormones as well. And it comes from two sources. So the liver produces cholesterol, and it produces all the cholesterol that you need, but you also can get it from your dietary choices. So foods that come from animals are typically the foods that contain cholesterol, such as meat, poultry, and dairy products like cheese and yogurt, things like that. So you have two types of cholesterol. There's LDL, which is considered the bad cholesterol, and HDL is considered to be good cholesterol. So two And I mixed this up in the slide. So too much LDL or too little HDL contributes to a higher risk of cardiovascular disease. So that waxy fat-like substance can actually, because of that waxy quality, it allows it to stick together and build up on the inner walls of arteries that supply your heart and your brain. So optimal cholesterol levels. So for LDL, which stands for low density lipoprotein, it's higher in fat and lower in protein. For men, ideal numbers are going to be less than 100 milligrams per deciliter, and for women, it's less than 100 as well. For HDL, these are different for men and women. So an HDL cholesterol is higher in protein and lower in fat. So for men, the recommended amount is 40 milligrams or higher, and for women, it's actually 50 or higher. So the total cholesterol, when you're including both of those, is normally in 125 to 200 milligrams per deciliter in both men and women. We also talk a lot about triglycerides. You've probably heard someone say, maybe I have high triglycerides. So it's not a type of cholesterol, but it is included as part of that lipoprotein panel that measures your cholesterol level. So you'll oftentimes see that included in labs. It's just another form of fat that also raises the risk of heart disease. So a normal level for that is below 150. All right, so let's talk about different types of fat. So you have good versus bad fat. So saturated fat typically is more associated with being a bad fat. So typically these fats are going to be solids at room temperature is a pretty easy way to think about them. Oftentimes these are from animal-based foods. So your meat, poultry, dairy products like cheese and butter and ice cream. Some vegetable sources are going to be coconut oil. If you think about having a jar of coconut oil at home, that is solid. Many palm oils. Some baked and fried foods as well also have saturated fat in them, and like your non-dairy whipped toppings and cream substitutes. All right, polyunsaturated fats. These are going to be unsaturated fats fall under your healthier fats. So there's different types of unsaturated fats. So polyunsaturated fats is one of them. These are oftentimes found in plant-based foods. So you've got your different types of vegetable oils like safflower oil, soybean and corn oils, tofu and soybeans. Tofu is made out of soybeans. Walnuts and sunflower seeds, and then your fatty fish are going to have these healthy fats. So salmon and tuna and mackerel, trout. There's some others. These are just some more common ones that I listed here. Oils that are rich in polyunsaturated fats do provide essential fats that the body needs, but you're actually not able to produce these on your own. So like omega-6 and omega-3 are very popular ones that you've likely heard of that fall into this category. These can actually help lower the LDL cholesterol levels, which are, again, those bad cholesterol levels. However, if you have too many of these, they can actually reduce the HDL levels as well if they're used in large quantities. So monounsaturated fat is another type of unsaturated fat. These are also found in plant-based foods. So oils like olive oil, peanut, sesame, and safflower oil, avocados, peanut butter, many nuts and seeds also have monounsaturated fats. So they also contain vitamin. Oftentimes these foods, they're rich in those monounsaturated fats, also give a lot of vitamin E to the diet, which is an antioxidant, which is very healthy. These also can help reduce the LDL cholesterol levels. And these provide many nutrients and help maintain the body's cells and their function. So a lot of foods are not just one thing, right? So they oftentimes will contain different types of fat and have more than just one type. All right, so let's talk about trans fat. In recent years, there's been a big movement by a lot of big food companies to get a lot of trans fats out of commercial food products because they have come out with research showing these are really not great for your health. So there are some naturally occurring trans fats. As noted here, they are produced in the guts of some animals and some of the foods that are made from them. However, artificial trans fats are created by adding hydrogen to liquid vegetable oils to make them more solid. So it's an industrialized process. So think like things like margarine, right? Like Crisco, things like that. They're very easy to use. They have a really long lifespan, which is something that makes them ideal for shelf-stable food products. And they're very inexpensive to produce. So, they do add a nice texture. They do taste good. However, they do raise LDL, or again, that bad cholesterol, and lower your good cholesterol levels. So, the consumption of these has been shown to increase risk of developing heart disease, stroke, and type 2 diabetes. Again, like I said, found in commercially fried foods and baked goods, margarine, shortening. And so you just want to limit these as much as possible. So looking for 0 grams of trans fat on nutrition labels can be helpful for that. And also if you're looking at the ingredient list, looking for partially hydrogenated oils is indicative that there are trans fats present as well. So some dietary changes that you can help impact your LDL or bad cholesterol levels with. So you want to decrease your saturated fat intake as much as possible, and look to get a lot of your fat sources from more plant-based sources and fatty fish. So replacing those with those monounsaturated fat or polyunsaturated fat foods. Limiting trans fatty acids as much as possible. This has gotten a lot easier to do in recent years with the movements that have been made by many of the commercial food companies again. And, just limiting dietary cholesterol intake from high fat meats and dairy products. So it doesn't mean you have to eliminate it completely. You just want to be careful about how much you're consuming. So changes to impact your good cholesterol levels and help bring those levels up. So you want to use more of those unsaturated, monounsaturated fatty acids, and rather than the polyunsaturated fatty acids. Losing weight, if you are overweight or obese, can be helpful. Limiting trans fatty acids. Avoiding high refined carbohydrate diet. So avoiding, again, like those white breads and pastas and baked goods and things that are low fiber. And exercising regularly actually is another great way to help increase your good cholesterol levels. All right, so for triglyceride levels, again, some more pretty similar recommendations. So including plenty of monounsaturated fatty acids and those omega-3 fatty acids. So like salmon is a great source of that, and walnuts as well. Eliminating alcohol or limiting it as much as possible, losing weight if you're overweight or obese, and again, limiting intake of those refined carbohydrate foods. All right, some tips to add more omega-3s to your diet. So, there's been a lot of talk about this in the media. So a lot of foods now, they'll advertise high in omega-3s on it. If you've noticed, like, your eggs at your grocery store, some of those cartons will say these have omega-3s in the yolk. So grinding up your own flaxseed to add to smoothies and granola, cereal, baked goods, etc., just as a little add-in to food. Grinding your own, if you buying flaxseed that's already ground, because of the high fat content, it's more likely that it will go rancid on you. Typically it's not going to be as great of a source. If you can grind up your own, if you have like a little coffee grinder or something like that, it's going to be better. If you don't want to grind your own, I just recommend that you keep your ground flaxseed in your refrigerator to help maintain its freshness. You can also add walnuts to your snacks as a yogurt topping. You can also cook with walnut oil. If you've never tried it, it's actually really tasty. It makes a great salad dressing. And aiming for at least two 4-ounce portions of fatty fish each week. So you can try new ways to cook fish. It's usually pretty quick to cook, which is nice. So it makes it a little bit more convenient. You can bake it, you can grill it, you can saute it, you can even steam it. So lots of options there. You can also take fish oil supplements. A lot of people are taking these, and that's a really great way to get omega-3s into your diet. It's easy. All right, so the role of fiber in heart health. Fiber is what I consider to be a very appreciated part of the diet. So a lot of people think about it in terms of keeping you regular, but it does a lot more than just that. So fiber actually helps to lower inflammation in the body. It can help with your blood pressure, and it can also help with cholesterol levels. So if you're eating foods with lots of fiber, it actually, if you're eating foods that contain cholesterol as well, it actually helps bind some of that cholesterol and help you pass it through your body. So, like I said, it helps normalize bowel movements and maintaining bowel health. It also can help control your blood sugar levels, again, because if you are eating carbohydrate foods with fiber, or eating just any food with that fiber in it, it's helping bind up some of that excess carbohydrate and help it pass through. It's also really great to help in achieving or maintaining a healthy weight. It's very satisfying, and it helps keep you full. So we've got some daily recommendations here. Most people are pretty well below this. So you can look at these. For men 50 or younger, the recommended amount is 38 grams a day. For men 51 or older, 38 grams a day. For women 50 or younger, 25 grams a day. And for women 51 or older is 21 grams a day. So if you're just adding a little bit into your meals and snacks throughout the day, these numbers are actually really easy to meet with just a little bit of intention. So some good sources of dietary fiber. So whole grain products are a great place to start. So these are those carbohydrate foods with fiber in them. So oats, quick and easy breakfast, any whole grain cereals, wheat bran, whole wheat pasta, brown rice, things like that. Some people don't like all of the whole grain products, but find the ones that you like and focus on those. Fresh vegetables and fresh fruits are excellent. Legumes, so those are like your beans and lentils. Peanuts are also a legume and great in fiber, and nuts and seeds. So nuts and seeds also have that healthy fat in them, in addition to being a great source of fiber. So there's two types of fibers. One is soluble fiber. So this is the one that helps bind that cholesterol and lower your overall cholesterol level. So what soluble fiber does in the body is it forms a gel-like material when it's dissolved in water. So it's dissolved in the fluid that you're consuming, your digestive juices. So it helps bind and remove bile acids from the body before they are reabsorbed, which helps lower your cholesterol levels. So some sources of soluble fiber. So oats, peas, bran, apples, citrus fruits, carrots, barley, and psyllium. Psyllium husk is actually a really great fiber supplement, especially if you do need help staying regular. It's really inexpensive, and you can just buy it in bulk. That's a great one to use. So the recommended amount is that you're consuming about 10 to 15 milligrams a day of soluble fiber. If that number is intimidating to you because you're like, why am I going to sit here and try to count soluble fiber grams? So don't get caught up in looking at whether it's soluble fiber or insoluble fiber. As long as you're eating a variety of soluble or fiber containing foods, you should be fine. Insoluble fiber sources, this is what helps actually move material through your digestive tract and increase stool bulk. So what is helping with those regular bowel movements? So whole wheat flour, often like a lot of whole grains, whole wheat bran. So wheat bran has soluble and insoluble fiber. Beans, lentils, and then many vegetables like cauliflower, green beans, potatoes, and there's many more than those as well. So ways to increase your fiber intake. So fiber, as with many things, there can always be too much of a good thing. So if you increase your fiber intake really quickly, you can potentially really not feel good. So it can cause diarrhea. It can also actually cause constipation if you increase your fiber intake too quickly and your body's not used to that. And it can make you feel like pretty bloated and uncomfortable. So the recommendation is that if you're going to increase your fiber intake, try to increase it by, a couple grams every few weeks and see how you feel so that your body has time to adjust to that. Choose whole grains whenever possible over refined grains. Again, I'm a big proponent of balance. So, if you're making 75% of your grain choices whole grains, but you really hate whole wheat pasta and you'd rather have just like regular pasta, that's okay, right? We're about balance. Try to choose whole fruits and vegetables rather than juices. So, when you're juicing, there are a lot of vitamins and minerals in there, but you are taking out all of the fiber out of that process. So, making sure that you're eating whole fruits and vegetables. Leave the peel on fruits and vegetables. The peel actually has a ton of fiber in it. For dips and snacks and things like that, bean dips and hummus are really great options. and trying to switch some of your protein options, which is kind of healthy anyway, to some more plant-based sources. Aim for, 1 or 2 meals a week to have a plant-based protein rather than an animal-based protein. So, having like black bean tacos, a lentil soup, something like that as your main course for a meal. Fiber supplements as well can help. So like I mentioned, that psyllium husk is a really great one. There's also some other ones like gar fiber and beta glucans, which are options as well. So if you search those, you can find them if that's something that you're interested in. So plant sterols and stanols. So these are naturally occurring compounds found in a plant cell membrane. So this is really just for your education, why this is helpful for improving your cholesterol levels and heart health. Again, this is not something I'd get too caught up in, and making sure that you're eating enough sterols or stanols. As long as you're eating a variety of plant-based foods, you should be fine. So these are structurally similar to the body's cholesterol, so they actually compete with cholesterol for absorption in the digestive system. So then unabsorbed cholesterol isn't leaving the body as waste. So these are found in fruits and vegetables, whole grains, nuts, seeds, all the things that you should be eating for a heart healthy diet. So some foods are also fortified with added sterols and stanols. These are called phytosterols. It's great marketing. And it's healthy, so it's good that they're adding these things. So they've added them to all sorts of things like cheese and milk and bread, orange juice, and even margarine products. All right, so aiming for a healthy body weight is also really beneficial to improving heart health. So as defined by the BMI range, you can see those ranges here. Just balancing your calorie intake and physical activity to achieve or maintain a healthy body weight. That said, I would not get too caught up in the BMI range, just because it doesn't take into account body type. It doesn't take into account your muscle mass either. So, if you know you can improve your physical activity and dietary habits, I'd recommend that you do that. But if you don't necessarily fall perfectly within a normal range, that is okay. All right, so some statistics from the US. So nearly 1 in 3 adults are overweight in the United States, and more than 2 in 5 fall into the obese category per BMI. So there's many factors that have contributed to this increase over the years. So just the types and amounts of food and beverages that are consumed, the level of physical activity that we are engaging in. So a lot of time now is spent engaging in sedentary behaviors, right? A lot of us have desk jobs, a lot of screen time, either for work or for pleasure. You go home at the end of the day, you sit in front of a TV. Sleep patterns and stress levels are actually a really big component that a lot of people don't think about. So your body, you're changing the hormones that you are producing. You're producing a lot of cortisol if you're really stressed out and you're not sleeping enough, which actually signals the body to hold on to more fat. Some medical conditions and medications do lead to changes in weight, which, sometimes is out of our control. And socioeconomic factors, what do you have access to? What can you afford? This is another huge component. Food is, especially healthier foods, tend to be very expensive in many places. All right, so weight control. So even a small weight loss, so just 5 to 10% of your total body weight, can produce improved health parameters. So it has been shown that it can help reduce that bad cholesterol and triglyceride levels. It can help increase your good cholesterol. It's really beneficial for helping reduce your blood pressure and blood sugar levels. It can, in some cases, eliminate the need for drug therapy, so having to take medications for these different conditions. It also can be great to be used in conjunction with drug therapy as well. All right, so I've got a picture of the plate method here. This is something that I really like to use just because it helps get a good visual of a balanced diet. It doesn't require you to weigh anything, count calories, or do any tedious types of tracking like that. So really what this is looking for, take away from this, about half of your plate is fruits and vegetables. A quarter of your plate is grain, so ideally whole grain foods or carbohydrate foods, and about a quarter of it being a protein. So some benefits of this. It does promote weight loss. Actually, if you're following this, it's really easy to use, like I said, and helps with portion control. This is based on about a 9-inch dinner plate. And it's just a simple way to build a balanced meal and have a balanced diet. So it helps improve the carbohydrate distribution. The standard American diet tends to be pretty high in those simple carbohydrates and protein foods, and a little bit lower on the fiber and fruit and vegetable side of things. All right, so let's talk about salt. Can't talk about heart health and not talk about sodium. So why does it matter? Why does this affect our heart health? So it does help maintain fluid balance. We do need some sodium in our diet. It is an essential nutrient. It also helps with nerve impulses and your muscle contraction. However, with certain conditions, and if you're consuming too much salt, you start to get excess sodium, which causes fluid retention in the body. So what happens when you have this excess fluid is it's very hard on your heart and your kidneys. So what that leads to is increased blood pressure, which in turn can lead to heart disease and potentially stroke. So consuming less sodium can help control these conditions. So with high blood pressure, this is a major risk factor for developing coronary artery disease, cardiomyopathy, and stroke. So again, some nutritional risk factors here: obesity, high sodium intake, low potassium and calcium intake, and excessive alcohol consumption. Diet and lifestyle modifications can help prevent the development of high blood pressure and reduce the need for medication. So for the most part, most of the sodium that you consume is actually not in the salt that you add to your foods. If you've ever said to yourself, well, I don't really sit around and have a salt shaker at the table and add that to my food, most of the sodium consumption that is for most people in the US, it's actually from processed foods and foods that you're eating out. It's not because you're adding extra salt. It's just because that salt is already inherently there. So increasing your fruit and vegetable intake and unprocessed meats and nuts and seeds, those are going to be lowering in sodium, but they also have more of other types of salt. So like more potassium in them and calcium, so helping balance out that ratio a little bit. So for dietary sodium, about half of hypertensive patients, so patients with high blood pressure, are salt sensitive, and is associated as well with obesity, race, and older age, right? There's some other factors that contribute to high blood pressure that are not just how much salt that you consume. So the current recommendation for the amount of salt that you consume for the DASH diets, that's the Dietary Approaches to Stop Hypertension eating plan, is less than 2,400 milligrams a day. So what 2,400 milligrams looks like is about 1 teaspoon. So if you think about it, you have a teaspoon of salt, and that's how much salt you have to sprinkle on your food all throughout the day. Then the 2020 and 2025 dietary guidelines for Americans, this recommendation is just a tiny bit less. It's at 2,300 milligrams per day. On average, a typical American diet does contain 3,400 milligrams of sodium or more per day. So you can see that number is quite a bit higher than the recommendation. So to decrease sodium intake, like I said, the majority of excess sodium is from processed food, canned foods, a lot of these convenience items. So cooking at home does allow you to control how much salt you are adding to your food. There's also a lot of other ways to add flavor to food. So a lot of like fast food, restaurant food, processed foods, they rely primarily on fat and sodium for flavor, which it does add, but there are many other ways. So herbs and spices are a great way to add not only flavor, but like lots of antioxidants to your food as well. So you have the spice blends that you buy at the grocery store, like the no added salt spice blends are a great option. If you do add salt to your food at the table, recommend that you definitely, take that away and make sure that you're reading your food label. So, canned items and some boxed items, there's some really good, healthy, convenience foods out there that I think are, important to incorporate. Not everybody has time to sit there and make every single meal from scratch. It's just like an unrealistic expectation. That's totally fine. But you do want to make sure that you are looking for like low sodium or salt-free when you are buying those foods. Okay, so Let's talk about the DASH diet. So we just looked at those recommendations for sodium intake. It can help lower blood pressure as well as bad cholesterol levels. So there is a lower sodium version of this diet as well. You know, potentially if you have like very high blood pressure, that might limit the intake to 1,500 milligrams of sodium per day. It's basically a flexible and balanced eating plan. So it does focus on foods that are naturally low in sodium, like we discussed. So fruits and vegetables and whole grains, fat-free or just low-fat dairy products, and lower fat meats like poultry and fish. A lot of red meat and pork intake or products tend to be pretty high in saturated fat. You know, so also including beans and nuts here as well. So really limiting those foods that are high in saturated fat. So full fat meats and full fat dairy products both tend to be pretty high. Also like the skin on meat. So if you're eating like chicken skin and things like that, that also has a lot of that saturated fat in it. All right, so Mediterranean diet. Definitely cannot go through a presentation on heart health without talking about the Mediterranean diet. I would say it's not so much a diet as it is a lifestyle, but it is very high in the consumption of fruits and vegetables, whole grain products, so whole grain breads and cereals, potatoes, beans, nuts, and seeds. So olive oil is the predominant fat source here, which is a monounsaturated fat. Dairy products as well as fish and poultry are consumed in like low to moderate amounts, really limiting red meat to like pretty rarely, consuming eggs a few times a week. Mediterranean diet does include alcohol, so wine consumed in low to moderate amounts, maybe a few glasses a week, and limiting added sugars, those refined grains, trans fat, refined oils, like canola oil, which is highly processed, processed meat, and highly processed foods as much as possible. So really focusing on a lot of those fresh foods with the Mediterranean diet. So here's a pyramid so you can have a visual that's looking of what the Mediterranean diet looks like. So you've got your meats and sweets up at the top and limiting those. This visual is also emphasizing making sure that you're drinking plenty of water as your primary beverage intake, and making sure that you're being physically active every day. You know, even if that's just taking a walk, it doesn't have to be a really hard workout, but just making sure that you're moving. Okay, so what about chocolate? So chocolate, dark chocolate in particular, so has a higher ratio of cacao to like the cocoa butter and the milk and all these other things that are added to chocolate. It's very high in flavonoids, particularly a type that is called flavonols, and this is associated with a lower risk of heart disease. So these are antioxidants, are also found in fruits and vegetables. So you do want to look at, you know, for like, we'll say the healthiest chocolate if you're looking for 70 to 85% cacao on the label. So this can absolutely be part of a healthy diet, everything in moderation, right? But you know, make sure that you're choosing the type of chocolate that you enjoy, not just because you think it's good for you. Okay, so I've listed some websites here if anybody is interested. You know, sometimes thinking of new things to cook, if you have a routine, that can be a little bit hard to change. But if you need some like inspiration for some heart healthy recipes, these different websites all have some really great options, and you know, make it as complicated or as easy as you feel comfortable with. You know, if you feel too intimidated, you're probably not going to do it. So start simple if that's where you feel comfortable. Okay, so in summary of everything we've talked about today, so I think that really the number one like overall takeaway from this is focusing on plant-based meals. So 3/4 of your plate. So if you've got that My Plate, again, half of that's fruits and vegetables. Another quarter of that is your whole grain products. That's 3/4 right there. Animal proteins, you're looking for lean meats ideally. So like lean red meat. So a lot of like your tenderloins, like sirloin, that type of thing is going to be leaner. Pork, poultry, fish, and low-fat dairy products. For fat sources, again, you want to focus on like olive oil, nuts, seeds, avocado, and your fatty fish. Making sure that you're eating plenty of plants daily. Variety is key here. You know, try to exercise most days of the week. Find something that you like and that you know that you'll stick with. You know, if you need to, losing 10% of your body weight and maintaining it, and just limiting your intake of alcohol and sweets. Okay, that is all that I have for you today. Does anybody have any questions?
Yes, if anybody would like to write something in the chat box, we will get these questions to her. And while we're waiting, I have a couple questions. You talked about the fats that if you're not careful too much, fat can actually cause cholesterol issues. How much fat is too much fat?
So I like to look at fat as more of like a condiment. I mean, as far as like the exact amount, it's like a ratio that they look at, but it's kind of not, it's very scientific, right? So it's not really a reasonable thing to focus on for your everyday diet. Most people aren't going to think about that. If you're adding like your salad dressing to your food and using olive oil, having some fatty fish, adding a little bit of avocado to your food, I would say just everything in moderation, right? So I like to think of it just like as a condiment to your meal. So you've got your meal with your fruit, vegetables, whole grains, and protein, and then add a little fat to that. Mm-hmm.
Great, thank you. Do you have to grind flaxseed?
You don't have to, but because it's really high in fat, when it's ground at room temperature, those fats have the higher risk of going rancid. Which, that sounds bad. So it doesn't taste great, and you're really not going to get the full benefit of the fat from that. So it's better to, if you don't grind it, keep it in your refrigerator for your best chance of keeping it fresh. You're just going to get more benefit from it if it's ground fresh.
Okay.
Yeah.
But do you have to grind them to get the benefit of them, or can you get any
You'll
benefit?
still get some benefit as long as, it's not a bag that's been sitting around forever. It's just going to be the best option is grinding it yourself.
Great. So here's a question. Are walnuts the only nut that is high in omega-3 fatty acids?
The only nut?
Uh-huh.
No, they are not. So other nuts do have walnuts are just the highest in the omega-3s out of all of them. So, you also have like, almonds and hazelnuts and pecans. All those are going to have some. Walnuts are just the best source.
Great. Next question is, now eating processed foods, canned beans, tofu, whole grain bread. Should I worry about this?
No, definitely not. Yeah, so, again, like those are convenience foods. Most people are not going to sit around and make their own bread. I definitely don't do that. It would be nice, but I don't do that. Yeah, so as long as, there's different types of processed foods, I would say there's like kind of tiers, right? So if you're looking for whole grain bread, your best bet is to go to the bakery section of your grocery store. It's going to have a lot less like additives and preservatives in there. So if you think about bread that will stay soft on your counter for a week, that's going to have a lot of preservatives and things like that, and a lot of additives to help it stay fresh. So getting stuff from the bakery and keeping it in your freezer to keep it fresh is a good option. Canned beans are great. Honestly, that's one of my favorite protein sources. That's really easy. Just make sure that you're draining them and rinsing off all of that excess bean liquid that's in that can, because that tends to be very high in sodium. Tofu as well is really great. You're just draining off the liquid. You can flavor it how you want to. Super high in protein. I love tofu, so yeah, definitely highly recommend that one.
Great. Next question is oil. Which oil do you recommend besides olive oil? Now, personally, I've heard if you cook with olive oil, that can turn bad, or is that?
Yeah, so what can happen is, so you have oils that tolerate different temperatures differently. So olive oil, if you're cooking with it at a low temperature, it's okay. But if you do cook with olive oil, like if you're like, cooking at a high heat, you wouldn't want to fry something in olive oil because you're changing its chemical structure. So you're losing a lot of the health benefits when you're changing the chemical structure of it. So if you're going to cook something at a high heat, actually, like even though it is a saturated fat, like a coconut oil is usually pretty resistant. Safflower oil, which we talked about in the slide, is good. Like grapeseed oil would be a good one. Avocado oil is great. That's one that I use a lot. That's a little bit more resistant to those higher heats. Olive oil is a great one, like if you're going to make your salad dressing, or if you are going to drizzle a little bit of extra on something for your food. So keeping it in a pure form and not cooking with it.
Great. What kind of over-the-counter cholesterol tests exist, or what is the quickest, cost-effective way to get one, and how often should you track it?
For most people, if you are like, I would say once a year. I don't know, to be honest with you, I don't know about over the counter. You kind of have to be careful with over the counter stuff. Your best bet is just to go to your primary care doctor and ask them to draw a lipid panel for you and just have it done every year to continue to check on that.
Great. Somebody says that they do not eat dairy products. So
Yeah.
what are some best sources of calcium?
Of calcium.
Mhm.
Gosh, there's actually a lot of good calcium containing foods that are not dairy products. So a lot of plants actually have them. So soybeans are a good one. Also, there's a lot of fortified foods with calcium. So like your like bran flakes, like Raisin Bran, stuff like that have a lot of calcium. A lot of plant-based milks are fortified with calcium as well. So if you did like a soy milk or an almond milk, dark leafy greens are a good source as well. So like your spinach and collard greens and kale and that type of thing are good. Sardines are actually a good source as well, if you like those.
Great. Is unground flaxseed absorbed, or does it just pass through the body?
Yeah, it passes through the body. So you do have to have it ground, whether you buy it pre-ground, keep it in the fridge or not. Yeah, the whole seeds just don't get broken down.
Great. Somebody is concerned. They've heard about there being toxins in tofu. Do you know anything about that?
I do not know anything about that, to be honest with you.
And then somebody asked again about grapeseed oil. Would you just give us a little more information about grapeseed oil?
Do they like what do you want to know specifically
I
about
think they
it?
just want to know, is that good for, it's good for reducing cholesterol? Is it good for cooking?
Yeah,
Or is it good for salad dressings or?
yeah, it doesn't really have a whole lot of flavor to it. It's a pretty like neutral tasting oil. So it's a pretty good, I like to cook with it, especially if you're gonna cook at higher heats with it.
Okay. Somebody asked if seaweed is also high in calcium.
I don't know actually. Hold on. As much as I wish I had the nutritional value of every food memorize. Let's see. Yeah, it looks like it does have a lot of calcium in it.
Great, thank you. I heard one time that knowing that processed foods are not the best for us, somebody I know would take fiber capsules when they were eating processed foods like a hamburger or something, and their idea was that with the extra fiber in there, it was pushing it through the body faster and they didn't have a glucose spike. I thought that was kind of odd. Is that true or not true?
I mean, in theory, that would work. Yeah, I mean, it would definitely help because then at least you're getting a meal that's, generally like very, very little fiber in it. And you are getting some fiber in there to help bind up some of the extra, some carbohydrate to help move that out. So it makes sense.
Okay, thank you. Somebody is wanting to know the recommendation for exercise. Is it still 150 minutes of moderate exercise a week?
Yes, it is. Yeah, it's 150 minutes of moderate exercise or 75 minutes of vigorous activity.
Okay, so the 75 minutes, is that just one day a week or does it matter?
75 minutes total throughout the week. So it's 150 minutes, which would be of moderate, which would be equivalent to 5 days a week for 30 minutes at a time, or yeah, however you want to spread that out.
Okay,
And this vigorous activity would be like, like running, like something that's really getting your heart rate up high.
okay, thank you. Do we have any other questions coming up? Sherry or Sadie or Havla, do you guys have any questions or anything you'd like to say?
Don't have any questions. I just really appreciated the conversation and you sharing your expertise and taking the time to do this. It was super helpful and very informative. So thank you from
No,
OC
thank you.
Tanner.
Sure. Mhm.
Yeah, thank you so much. I mean, it can be so confusing for people, especially when you're trying to eat healthier and you're talking, about the chemicals with our, the chemical structure can be changed when we start cooking. And so what's a good resource for people to refer to, maybe when they're at the grocery store or they're at home getting ready to cook up a meal?
So honestly, like any like for like recipe ideas and like food ideas.
Yeah.
Yeah.
Where's a good
So
resource?
if you guys want, I can go back to the slide. Hold on. You guys see that? These websites would be like if you just wanted to pull them up on a tab on your phone, these all have really good ideas, really good resource ideas.
Great, and I will be sending this PowerPoint out in a PDF, so you guys can look that up. I'm sure your wellness coordinators will also be glad to get those up for you. And we'll also have a recording if you want to listen to this again, so you can get all of these links.
Great.
Okay, I don't see any other questions. So I'm going to say that we are through with this presentation for the day. We're getting a lot of thank yous. They learned a lot from your webinar. So I thought it was great, and I learned some new things. I always like to learn new things about good nutrition because there's always so many new and such a variety of things out there.
Yeah,
So,
yeah.
Julianne, thank you
There's an
so
excess
much.
of information for sure.
Yeah, it's a never ending. Like I used to use olive oil all the time for cooking, but now I have pretty much turned it over to avocado oil, which I absolutely really like. It's
Yeah,
has a great flavor.
great oil.
Yeah, and it's really healthy. So I really like that one. And somebody, but thank you. Avocado is life. I love avocados. So thank you very much. I really appreciate you coming to do this with us today. And everybody from Salt Lake County got the link, hopefully, and everybody from BD Medical, Sherry told you how to get your points for being here today. And thank you, everybody, and have a good weekend. I guess Monday is President's Day, so if you get the day off, have a great 3-day weekend.
Awesome. All right. Thank you. Take care.
Thank you.